All right. Hello, everyone, and thank you for joining us today for Work Smarter, Not Harder, where we are going to be discussing the role that technologies such as AI and automation can have in improving patient privacy in your organizations. So my name is Demi Borden. I am the Manager of Customer Success at iatricSystems. I work with all of our patient privacy monitoring solution customers, our product Haystack IS. My team works to support them as they use this product to expand their privacy programs. We also have Nicole Gaarenstroom with us today from Renown, and I'll let her introduce herself a little bit.
Thanks, Demi. So again, my name is Nicole Gaarenstroom. I'm a privacy coordinator at Renown Health. We're a multi-hospital system in Reno, Nevada. I focus a lot on triaging and managing our privacy investigations throughout the system.
Yeah, so in the short 20 minutes we have with you today, we are going to be asking a few questions that can help you identify what your current processes are in your privacy programs, as well as ways that you can improve those processes. We'll be discussing the role that AI and automation can have in those improvements, and then how that technology can also help you uncover and manage trends that you may not be aware of within your organization. So after all that's done, we'll round it up in a couple best practices that hopefully you can take and use within your own teams. So when we think about managing patient privacy, it can seem like a really daunting task. You're managing a lot of data. You don't know where to start, or maybe you feel like you're one step behind, or maybe you just don't know what you're supposed to be looking for in the first place. It can be really overwhelming. So let's get a little bit of clarity and take a step back. You need to identify what it is exactly that you are doing now. So is it more proactive to where your teams are looking through the data and trying to find any suspicious behavior and get in front of it? Or is it more reactive at this time where you're only really starting an investigation once your team gets a tip or a complaint called in? After you kind of figure that out, you can, again, take a step back and see what tools does my team have right now to complete these investigations. A lot of the times, to start off, they don't really have many tools in their pocket. So they are going to the EHR and manually running these reports, very general reports, and just kind of sifting through endless data, trying to find an anomaly. Well, once an anomaly is found, now what do they have to do? They have to go back to the EHR, run another general report on that user or that patient, sometimes not even just in your EHR, but across multiple systems where data is stored. They're looking at 1, 2, 3, 4 reports of access and trying to piece together this timeline or paint the picture of what was accessed and why. But how much time did that actually take your team? That takes a long time. That's a lot of data to get through. How do you get your arms around patient privacy when it takes so much time of your team's time, energy, and attention just to investigate one anomaly? So that's why we need to start thinking about how we can work smarter. What technology is out there to land on top of this mountain that is patient privacy? But first, what is it that people are actually doing that you might not be aware of? And Nicole's on the front lines at Renown, so she's going to tell you a little bit about that.
Thanks, Demi. So when we start to think about what are people doing when it comes to privacy and inappropriate access specifically, we can kind of categorize all of this access into 3 separate categories. So our first category here is carelessness. A lot of times these are going to be things that are human error, right? So we have PHI being handed to the wrong patient or being sent to the wrong patient. We have issues with proxies or the patient portal. Those can just be results of human error. Same with registration issues, if patients are registered incorrectly or if the charts are documented incorrectly. Again, these are carelessness. This is our human error. A lot of times these are the things that can be corrected by employee intervention or by education. Our second category here is concern. So we think of these things as things that may not necessarily be a reportable privacy breach, but things that are going to be more along the lines of our policy violations, right? So we have our self-access. We have our employees that are accessing their family members' charts, their kids, their spouses, these things that they're accessing out of the concern for the health of usually their family. So this is our concern category. And then our third category here is curiosity. So this is kind of where we get into our reportable breaches. This is where we get into a lot of our, I guess, the meat and potatoes, you can say, of our investigations. So we have our coworker access, our VIP patient access, things like that. We have a lot of times our employees are accessing the charts of people that they may not know directly or may not have direct relationship with, but they've heard of or they know about. So this is where we get into that curiosity portion. And again, these are going to be where our breaches result from, and this is where we're going to spend the majority of our time. So when we start to think about all of these different types of accesses, these three categories, our next question is really, well, what can we do about it? What can we do about all these different things? And our first step in that is to review our process. So when we start to take a look at our process, the first step in that is going to be figuring out where we can start to move from a reactive approach in terms of privacy monitoring to a proactive approach. So we start to think about where we can wrap our arms around everything and where we can address these three categories. Part of that is going to be in terms of early awareness. So we have we go back to that curiosity category. We think about being aware early of these incidents and providing education to those employees as soon as possible, right? And then we start to think about as well where and when we can educate to avoid that human error. So we use this data that we're beginning to find or that we're beginning to receive to figure out where and when we can educate these employees to prevent these breaches from happening in the first place. And then if we go back to that third category, we can start to also think about determining what is policy versus what is a HIPAA violation, and think about where and when we can intervene in those as well. So if we can address our policy violations easy right away, we can reduce our workload and save us a little bit of time when it comes to addressing some of those more in-depth privacy investigations. So what are the major ways that we can accomplish, again, moving from this reactive to this proactive approach is through our data and through technology, which I'm gonna have Demi talk a little bit about now.
Yeah, so a moment ago, I had mentioned that we would need to work a little bit smarter and start utilizing the technology that is out there to land on top of the mountain that is privacy. And I really do believe that a mountain is a great analogy. If you think of patient privacy as this mountain, then that means all of the data streams that you have, all the systems where data is being stored, all of the departments, the facilities that you have that your team is trying to keep a watchful eye on is the valleys and the streams and the towns that's surrounding this mountain. Now, when you have that picture in your head, where do you want your privacy team to be? When they don't have the tools that they need, they end up right at the base of the mountain with everybody else. They're running in circles, chasing this data, trying to get ahead of it. By getting a patient privacy monitoring solution or technology like it is elevating your team to the top of that mountain, giving them the 360 bird's eye view of everything that's going on. And that way they can start to uncover trends that you may not be aware of, as well as focus education in those areas and see the bigger picture of what's going on. Now you might be like, well, what is this magic tool? Well, the technology that is used in patient privacy monitoring solutions includes AI, automation. We take your data and analyze it against different algorithms. So it's analyzing that data for you to uncover suspicious behavior. That way you aren't spending all of your time trying to analyze that data yourself. So what it's doing is it's taking all that data, it's running it against those algorithms, and it's identifying when there's coworker accesses, when there is neighbor accesses using geolocation. It's identifying family accesses to VIPs that might not be part of their own job. So that's where the artificial intelligence comes in. You can use that to track what your employees do on a day-to-day basis and alert your team when they stray from that normal behavior. That's something that a report just can't give you when you're just looking at it at its face. Another really great tool that these things have for you is the ability to automate certain investigations. So with Haystack IS, for example, we have a tool called our Advanced Virtual Assistant, or AVA for short. And what AVA does is AVA will look for an investigation that you tell it to watch for. And will send out a questionnaire to the user or the manager and gather information for your team. Now, when these certain incidents come up, these are questions you'd be needing to ask these users or these managers anyway. So it's helpful to have that tool that's already grabbing that information for you and placing it on your team's desk. That way you have more time to focus on the things that can't be automated, the things that it's not kind of repetitive. I know that Nicole has also used Ava herself at Renown, and it's helped expedite a couple different investigations that they've had. So I'll let her talk about that a little bit.
Yeah, so just recently we had an investigation that involved a VIP patient of ours. Due to some media attention around this patient, it caused quite a stir within our employees, as I'm sure you can imagine. As things come up in the media and patients become aware, other employees become aware that a certain patient is in the hospital, obviously our employees start to get curious. So they start to look through the chart. So one of the things that Ava has been able to help us with is identifying those a little bit earlier. So in this specific instance, we were able to identify all of the specific accesses to this one specific patient and address them much quicker than we had been in the past. Because we weren't combing through access logs, we weren't combing through the EHR, we weren't looking manually for all of these different accesses and their reasons for accesses. Ava kind of drops it on a plate for us and says, this is what was accessed, this was accessed inappropriately, and this is what you need to address. So we were able to address those specific employees much quicker, and we were able to prevent that from spreading even further. So by addressing our first 3 employees that had accessed, by providing education to those departments a lot quicker, we were able to stop it from 10, 20, 30, however many employees may have accessed had we not stopped it so quick. So thinking about all of the data that we have and ways to utilize it, we want to make sure that we are using this data to find our high traffic departments, to identify our important job areas or those high traffic job codes, things like that, and figure out who our frequent offenders are, or who our important offenders are, so that we can provide customized education to those employees or to those departments before it becomes a bigger issue. So we can also utilize this to predict spikes in access. You can use the data to predict spikes in access. So for example, in October, November, we see a huge spike in things like family member access or self-access, access of their children, things like that. So we can provide education in the beginning of October, late September, to tell our employees, hey, we know that the holidays are coming up. Please remember that this is against our policy and you should not be accessing your family members' charts. So we can go ahead and provide that education before we know it's going to be an issue, to kind of avoid the issue altogether. We can also use this data that we're gathering from Ava to schedule implementations and projects and things around trends that we're finding. So when you're doing your compliance planning, program planning for the year, it's nice to be able to say, oh, we have huge spikes in access for whatever reason in March and December. So we want to make sure that any risk assessments and things like that we're planning throughout our program are happening at different times, so that we don't end up overwhelmed with both investigations and other compliance program projects. So now that we've talked a little bit about the ways that we can utilize this data in our day-to-day lives, I'm going to pass it back over to Demi to talk about some best practices.
Yeah, so I believe one of the best practices that you can take away today is actually using the data that you have to prevent breaches instead of getting buried underneath it. So you can take all this data and start to review your own workflows. Review your own workflows and discover any gaps that you have. You can also take it to review your policies and your procedures and see what might need to be tweaked a little bit and what's working for you now. Find the technology that works for you to audit access and utilize the automation that's out there. I think automation is underutilized in healthcare at this time, and that we should take advantage of it a little bit more. And then also, I just love the idea of scheduling implementations and projects around the busier times of year. It's something I never thought about when I talk to my customers, so I love to hear it from Nicole when I talk to her. You can also use this data to start tailoring your education, as Nicole was just talking about. So identify the trends, identify the high traffic departments, job titles, facilities that are in your jurisdiction. And then determine where you need to reinforce education. So by identifying trends, being on top of that mountain, you can say, there's a lot of action going on in this department over here. This is where I should focus some of my efforts in education. And then throughout all of this, don't forget to track your progress. You want to be able to make changes now and come back next year and say, this is what worked, this is what didn't, and this is what we just need to tweak a little bit more. And with that being said, if you have any questions at all, we are booth 1641, iatricSystems. It's actually right over there. So come and chat with us, and we'd love to talk about patient privacy with you. Thank you.
Thank you.